If you have noticed tiny grooves near your gum line or a sharp sting when cold water touches one tooth, do not ignore it. Those small tooth notches may look harmless at first, but they can be a warning sign that the weakest part of your tooth is under stress. Many people after 50 assume this is just normal aging. They think, my teeth are getting older. There is nothing I can do. Others go in the opposite direction. They brush harder, buy stronger whitening toothpaste, or try online remedies that promise to rebuild enamel almost overnight. Unfortunately, both reactions can make the problem worse. Today, we are going to talk about 7 common mistakes that may deepen tooth notches, increase sensitivity, and irritate the gum line. This is not about fear. It is about understanding what is actually happening. Tooth notches near the gums are often connected with several forces working together: gum recession, enamel or cementum wear, acid exposure, brushing pressure, dry mouth, and sometimes bite stress from clenching or grinding. The good news is that many daily habits can be adjusted before the sensitivity becomes more painful. By the end of this video, you will know what to stop doing, what to do instead, and when it is time to see a dentist. And the most important mistake is not the one most people expect. So stay with me until we reach number 7. Mistake 1. Brushing harder because the tooth feels rough. The first mistake is brushing harder because the area near the gums feels rough, stained, or sensitive. This is very common. A person notices a small groove near the gum line, runs the tongue over it, and thinks, maybe I am not cleaning well enough. So they press harder with the toothbrush, especially in a back and forth motion across the gum line. But the gum line is not a kitchen counter. You cannot scrub it into health. The area where the crown of the tooth meets the root is more delicate than the chewing surface. If the gum has receded even slightly, the root surface may be exposed. Root surfaces are not protected by the same thick enamel that covers the top of the tooth. That means aggressive brushing can wear the area faster and make sensitivity worse. A safer approach is to use a soft bristled toothbrush and gentle pressure. Think of cleaning, not scrubbing. Place the brush at a gentle angle toward the gum line and use short, controlled strokes. If the bristles bend outward, you are probably pressing too hard. An electric toothbrush with a pressure sensor can help some people, but the tool is not magic. The key is pressure control. A soft brush used gently is usually better than a powerful brush used aggressively. Here is the simple rule. If brushing causes pain at the gum line, bleeding, or a lingering sting, do not respond by brushing harder. Slow down, soften the pressure, and ask your dentist or hygienist to check your technique. Mistake 2. Brushing right after acidic foods or drinks. The second mistake is brushing too soon after acidic foods or drinks. This one surprises many people because brushing feels like the responsible thing to do. You drink orange juice, lemon water, soda, wine, or coffee with acidic flavor, and you want to clean your teeth immediately. But acid temporarily softens the outer tooth surface. If you brush right away, especially with pressure, you may be rubbing a softened surface at the exact moment it is most vulnerable. This does not mean you can never enjoy acidic foods. It means timing matters. After acidic drinks or meals, rinse with plain water. Let saliva do its natural buffering work. If possible, wait about 30 minutes before brushing. This is especially important after 50 because several things may reduce your natural protection. Some people have lower saliva flow. Some take medications that dry the mouth. Some sip acidic drinks slowly throughout the day, which keeps the mouth in an acidic state for longer. A better routine is simple. Drink acidic beverages with meals instead of sipping them for hours. Use water afterward. Avoid swishing acidic drinks around your teeth. If you enjoy lemon water, do not treat it as an all-day wellness drink. A small habit that seems healthy for digestion may not be friendly to sensitive teeth if it constantly bathes the enamel and exposed root surfaces in acid. The goal is not perfection. The goal is to reduce the number of acid attacks your teeth face every day. Mistake 3. Ignoring dry mouth. The third mistake is ignoring dry mouth. Saliva is one of the mouth's most underrated defenses. It helps wash away food particles, neutralize acids, and carry minerals that support the tooth surface. When your mouth is dry, your teeth lose part of that natural protection. Dry mouth is not simply getting older. It can happen for many reasons, including dehydration, mouth breathing, diabetes, Sjogren's disease, cancer treatment, and many common medications. Medicines for blood pressure, depression, allergies, sleep, bladder control, and pain can contribute to dryness in some people. Why does this matter for tooth notches and sensitivity? Because a dry mouth can make acid and plaque more damaging. If the gum line is already exposed, the root surface becomes more vulnerable. The person may notice more sensitivity, more cavities near the gum line, or a sticky feeling in the mouth. A practical first step is to notice your pattern. Is your mouth driest at night? After medication? After coffee? Do you wake up with a sticky tongue or need water by the bed? These clues matter. To support saliva, sip water regularly, especially with meals. Limit frequent sugary or acidic drinks. Ask your dentist about alcohol-free mouth rinse, fluoride options, or saliva substitutes if dryness is persistent. Sugar-free gum or lozenges may help stimulate saliva for some people, but choose products that do not bathe the teeth in sugar. And if dry mouth is new, severe, or constant, bring it up with both your dentist and your doctor. It may be connected to medication or a health condition that can be managed. Mistake 4. Using whitening, charcoal, or abrasive toothpaste too often. The fourth mistake is using whitening, charcoal, or abrasive toothpaste too aggressively. When someone sees discoloration near the gum line, they often reach for a toothpaste that promises a brighter smile. But not every toothpaste is ideal for sensitive teeth or exposed root surfaces. Some products remove surface stains partly by using abrasive ingredients. Used occasionally and appropriately, many toothpastes are safe. But if you combine an abrasive paste with hard brushing, acidic habits, and gum recession, the gum line may suffer. Charcoal toothpaste is especially popular online, but popularity is not the same as safety for every mouth. For someone with tooth notches and sensitivity, the question is not, does this make my teeth look cleaner today? The better question is this helping protect the vulnerable area near my gums over the next year? For sensitive teeth, many dentists recommend a toothpaste designed for sensitivity or a fluoride toothpaste that helps strengthen enamel and reduce cavity risk. Some sensitivity toothpastes work by helping block microscopic tubules in dentin, which can reduce the pain signal over time. These products usually need consistent use. They are not instant miracles. A simple improvement is to stop rotating between harsh whitening products and choose one gentle, protective toothpaste for several weeks. Use a pea-sized amount, brush gently, and do not rinse aggressively afterward unless your dentist has instructed otherwise. Let the toothpaste have time to contact the tooth surface. If whitening is important to you, ask your dentist which method is safest for your teeth, especially if you already have sensitivity or gum recession. Mistake 5. Treating gum bleeding as a reason to avoid cleaning. The fifth mistake is avoiding the gum line because it bleeds or feels tender. This can create a damaging cycle. The gums feel sore, so the person avoids brushing near them or stops cleaning between the teeth. Plaque builds up. The gums become more inflamed. The inflammation makes bleeding more likely. Then the person avoids the area even more. Gum health matters because gum recession can expose the root surface. Once the root surface is exposed, sensitivity and root cavities become more likely. So protecting the gum line is not just about fresh breath. It is about keeping the foundation around the teeth as healthy as possible. The solution is not aggressive cleaning. It is gentle, consistent cleaning. Brush the gum line carefully with a soft brush. Clean between the teeth daily with floss, interdental brushes, or another tool recommended by your dental professional. If floss snaps painfully or cuts the gum, your technique or tool may need adjustment. Bleeding that improves after better cleaning may be a sign the gums were inflamed from plaque. But bleeding that continues, worsens, or comes with swelling, loose teeth, bad taste, or receding gums should be evaluated by a dentist. Gum disease is not something to manage only with home remedies. For a real-life example, imagine a 58-year-old woman who avoids one side of her mouth because cold water hurts. She stops cleaning that area well. Within months, the gum feels more tender and the notch feels deeper. The problem was not only the notch. It was the avoidance pattern. Gentle daily care, plus a dental check, breaks that cycle. Mistake 6. Ignoring clenching, grinding, and bite stress. The sixth mistake is thinking tooth notches are only caused by brushing. Brushing pressure is important, but it is not the whole story for everyone. Some notches near the gum line are part of a broader group called non-carious cervical lesions. That means tooth structure is lost near the gum line, but not because of a traditional cavity. These lesions may involve abrasion, erosion, and bite-related stress. In simple terms, the tooth may be affected by mechanical rubbing, acid exposure, and forces from the way the teeth come together. If you clench your jaw at night, grind your teeth, wake up with jaw soreness, or notice flattened tooth edges, bite stress may be part of the picture. Over time, repeated pressure can strain vulnerable areas of the tooth. It may not act alone, but it can combine with acid and brushing abrasion. The signs are not always obvious. You may not know you grind. A partner may hear it. You may wake with tight jaw muscles. You may have headaches near the temples. You may notice chipped fillings or a tired feeling in the face. If these signs sound familiar, do not try to solve it by buying a random hard mouth guard online without guidance. A poorly fitting guard can create new problems. Ask your dentist whether a custom night guard, bite evaluation, or treatment for jaw habits is appropriate. During the day, practice a simple awareness check. Lips together, teeth apart, tongue relaxed. Many people rest with their teeth touching without realizing it. Your teeth should not be clenched all day. Small moments of relaxation can reduce unnecessary force. Mistake 7. Chasing internet repair hacks instead of getting the tooth checked. The seventh mistake is the most important. Chasing internet repair hacks instead of finding out what the notch really is. Online videos often promise that one mineral, one oil, one rinse, or one secret routine can fix tooth grooves quickly. Some ingredients may support oral health. Some toothpastes may help sensitivity. Fluoride and certain remineralizing agents can support the tooth surface in specific ways. But a true groove, worn root surface, cavity, crack, or gum recession cannot be correctly diagnosed through a screen. This is where people lose time. They keep trying remedies while the cause continues. If the notch is from aggressive brushing, the habit needs to change. If acid reflux is contributing, that needs medical attention. If dry mouth is raising cavity risk, that needs a plan. If clenching is involved, the bite forces need to be addressed. If there is decay at the root, it may require dental treatment. Do not wait if you have sharp pain, sensitivity that lasts after the cold is gone, swelling, bleeding that does not improve, a visible dark area, a broken filling, or a notch that seems to be growing. These are not signs to cover up with stronger toothpaste. The safer message is this. You may be able to reduce sensitivity and slow further damage with better habits, but you still need to know what you are dealing with. A dentist can check whether the area is abrasion, erosion, gum recession, a cavity, or a crack. The right treatment may be as simple as technique changes and sensitivity toothpaste, or it may involve fluoride varnish, bonding, a night guard, gum treatment, or restoring the area. The earlier you understand the cause, the more options you usually have. Here is a simple 7-day gumline protection reset you can start at home. First, switch to a soft bristled toothbrush if you are not already using one. Brush twice a day for 2 minutes with gentle pressure. Keep the strokes short and controlled. Do not saw back and forth across the gum line. Second, choose a protective toothpaste. For many adults, This means a fluoride toothpaste. If you have sensitivity, consider a toothpaste designed for sensitive teeth and use it consistently for several weeks. Do not switch products every few days. Third, change your acid timing. After coffee, citrus, soda, wine, vinegar-based foods, or lemon water, rinse with plain water and wait before brushing. Avoid sipping acidic drinks slowly for hours. Fourth, support saliva. Keep water nearby, especially at night. Notice whether your mouth feels dry after medications or during sleep. Ask a professional about dry mouth strategies if this is persistent. Fifth, clean between the teeth once daily. Use the method you can do gently and consistently. Floss, interdental brush, or another tool recommended for your mouth. Sixth, check your jaw during the day. Several times daily, ask, are my teeth touching? If yes, relax them apart. If you wake with jaw tightness, ask your dentist about grinding or clenching. Seventh, track your symptoms. Write down which teeth hurt, what triggers the pain, and whether the sensitivity disappears quickly or lingers. If symptoms persist for more than a short period, worsen, or come with visible changes, schedule a dental appointment. This plan is not meant to replace professional care. It is meant to remove the common daily habits that keep irritating the same vulnerable spot. Tooth notches after 50 are not something to panic about, but they are also not something to ignore. They are often a sign that the gumline area is facing more stress than it can comfortably handle. The biggest mistakes are usually simple: brushing too hard, brushing right after acid, ignoring dry mouth, using harsh whitening products, avoiding bleeding gums, overlooking clenching, and trusting online repair promises without a proper dental check. The most encouraging part is that small changes can make a real difference. A softer brush, gentler pressure, better timing after acidic foods, more attention to saliva, and consistent gumline care can help protect your teeth from further irritation. Start with one change today. Tonight, brush gently for 2 minutes with a soft brush. Tomorrow, rinse with water after coffee or citrus and wait before brushing. Over the next 7 days, pay attention to what your teeth are telling you. Consistency matters more than intensity. Your teeth do not need punishment. They need protection. If you have tooth notches or sensitivity, which habit do you think may be affecting you the most? Brushing pressure, acidic drinks, dry mouth, or clenching? Share your answer in the comments. And if you want calm, science-based guidance for staying healthy, strong, and confident after 50, subscribe to Nature and Youth. I will see you in the next video.